Training tomorrow's doctors. The primary objective of the medical profession is to produce generations of scientifically grounded and clinically skilled physicians who can provide patient-centered care. Humanistic approach to patient care in these digitalized healthcare systems set physicians apart from any other healthcare professionals. That is to render service to humanity and that any reward or financial gain is a subordinate consideration. Hence, a future doctor should be instructed or taught the art of healing. Universal health care, also referred to as kalusugan pangkalahatan, is the provision to every Filipino of the highest possible quality healthcare services that is accessible, efficient, and equitably distributed. The government offers these medical services to all citizens regardless of their ability to pay. The sheer cost of providing this quality healthcare under the UHC program is a large expense for the government. Hence, before its implementation, the government must see to it that our PHIC, who will be in charge of paying the healthcare providers like hospitals and clinics for services rendered to the Filipinos, must be fully funded and is capable of sustaining this program. Secondly, before its implementation, there must be information dissemination campaign on the implementing rules and regulations of the universal health care down to the barangay level so that all Filipinos will be informed and empowered. As early as March or April last year, when the COVID-19 infection hit the National Capital Region, General Santos medical community requested for a meeting with our LGU. We informed them of what is COVID-19 infection and how we can help. Our objective then was how to limit the COVID-19 infection once it hits our city. That is to limit the spread of the disease and to limit the number of deaths. We had massive information campaign on what is COVID infection, what is pandemic, and what are the standard healthcare protocols to prevent its spread through social media, radio programs, and lectures down to the barangay level. The medical community also requested our LGU to provide for quarantine facilities, while the doctors provided for the guidelines or protocols for all the COVID hubs that will be put in place in all private and government hospitals. We also requested the LGU, the IATF for strict border control, that is to limit the entry of non-essential workers into our city. Our local medical community volunteered and actively participated in our LGU, IATF, and DOH campaign and response in this pandemic. And as of today, the COVID-19 infection in General Santos City is still manageable.